Hi, my name is Chrissy. I'll be your student nurse today.
Hi.
Could you please state your name and date of birth?
Kayla Frazier, 10/26/1999.
So that makes you 20?
Mm-hmm.
Okay. And are you a student or are you working?
I'm a student.
So you eat at the dining hall?
Yes.
3 meals a day?
Mm-hmm.
Good. And what do you identify as?
Female.
Okay. And could you please state your pain level on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt?
0.
Good. Okay, so your hygiene looks good, your mood and affect is good and congruent with your facial expressions, which is content. You have good nutritional status, and you don't seem to have any physical deformities that are obvious to me. So first we're going to start with your hands. So I'm just going to feel your hands. They feel warm to the touch and pink. Your capillary refill is less than 3 seconds, which is normal. Your skin trigger is also normal. Now I'm going to move on to your head. So there doesn't seem to be any lumps, bumps, or lesions. Is it okay if I feel your head?
Mm-hmm.
So I don't feel any lumps, bumps, or lesions, and your hair distribution is equal and normal. So now we're going to do some facial expressions. So could you smile, and frown, and puff out your cheeks, and show your teeth, and squint your eyes, and raise your eyebrows? Good. So that is cranial nerve 7, which is intact. So now I'm going to feel your jaw. So could you clench? And one more time. So that's cranial nerve 5, which is intact. And now we're going to move on to eyes. So if you could close one eye and just let me know when you see this pen in 3 different positions.
No. No. No.
And to the other side.
No. No. No.
Good. So that's cranial nerve 2, which is intact. So if you could look over this shoulder, and I'm going to shine a light in your eyes, and the lights have been dimmed. Okay, and over this shoulder. Good, so your pupils are dilating, so that's cranial nerve 3, which is intact. So now we're going to move on to cranial nerves 4 and 6. So if you could follow this pen just with your eyes. Good, so cranial nerve 4 and 6 are intact. So now I'm going to move on to your ears, and I'm feeling for any lumps, bumps, or lesions. Is there any tenderness with that?
No.
Okay. And could you close your eyes and let me know when you hear this sound?
No.
No. Good. So cranial nerve 8 is intact. So now I'm going to move on to your nose. So if you could close one nostril and breathe in the other one, and repeat on the other side, and close your eyes and let me know when you smell this.
No.
Good. So that's cranial nerve 1, which is intact. So now we're moving on to the mouth. We're just going to look at your teeth and gums. So first I'm going to look at your lips and buccal mucosa. The buccal mucosa is pink, and your lips are also pink and hydrated. Your teeth are white and strong, and your gums are pink and strong. I can see your hard and soft palate. Hard is white, pink, soft is pink. So if you could stick out your tongue and say ah. Good. So your uvula moves up, which means that cranial nerves 9 and 10 are intact. And if you could stick out your tongue and move it side to side and repeat after me: light, tight, and dynamite.
Light, tight, dynamite.
Good. So cranial nerve 12 is intact. So next I'm going to move on to your neck and look for symmetry. There doesn't seem to be any lumps, bumps, or lesions. I'm just going to feel for any lumps, bumps, or lesions, and there doesn't seem to be any. Skin is warm to the touch, and your trachea is midline. I'm going to feel for your carotid pulse. And that's a 2+ on each side, which is normal. And so now I'm going to listen with the bell of my stethoscope for any bruise. Okay, so there are no bruise present, which is normal. And so next we're going to do some range of motion to assess cranial nerve 11. So if you could tilt your head down to your shoulder and the other side and turn right and left and look down and look up. And so now we're going to do that against my resistance. So look right and look left. And if you could raise your shoulders. Good. So cranial nerve 11 is intact. So now you can spin around. And careful. And so now I'm going to assess your back and your, there doesn't seem to be any lumps, bumps, or lesions. Your skin is warm to the touch. And your thoracic cage is midline. Your ribs are pointing downward, which is normal. And so next I'm going to assess for symmetrical expansion. So if you could take a deep breath in and out for me. Good. So my hands moved apart symmetrically, which is normal. And now I'm going to assess for tactile firmitis. So when you feel my hand, just say the number 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good. So there are equal vibrations with that. And now I'm going to assess for percussion. Okay, so your percussion sounds sound good. And now I'm going to move on to your breath sounds. So when you feel my stethoscope on your back, just take a deep breath. In and out with your mouth open. Okay, so your breath sounds sound normal, so now you can spin around for me. I'm going to assess your anterior chest. So there doesn't seem to be any lumps, bumps, or lesions. Your skin is warm to the touch, and now I'm going to go ahead and listen to this as well for heart sounds or breath sounds. So you can take a deep breath in when you feel this. If you feel like you're going to pass out at any time, let me know. Good, so breath sounds sound normal. And so now we are going to assess your upper extremities. So it doesn't seem to be any lumps, bumps, or lesions visible to me. So we're going to do some range of motion. So if you could put your arms out straight and flip them, and bend your elbows back out, flip them back, and spread your fingers together, down, up, make a fist. Okay, and if you could move your arms back behind you, behind your back, up behind your head, back down, back up once more, and then you're going to do that one against my resistance, and your arms straight out towards me against my resistance. Good. So now I'm going to have you lay down for me, and you could tilt your head to the left, and I'm going to assess your jugular pulse. And I see it right here, and there's no distension. I'm also going to look at your precordium for any pulsations, lumps, bumps, or lesions. And I'm going to palpate that for any thrills, lumps, bumps, or lesions. And I don't see any present. And so now I'm going to feel your apical pulse. And I'm going to listen to your heart sounds now. So I'm going to listen at the apical, the pulmonic, the tricuspid, in the mitral, and I'm going to listen to this for 1 minute. So that is 62 beats per minute, which is normal. And now I'm going to assess your abdomen for any lumps, bumps, or lesions, which I don't see any present. Your skin is pink, and your umbilicus is midline and indented. So now I'm going to listen to the vowel sounds in the 4 quadrants. So starting with your right lower quadrant, your right upper quadrant, your left upper quadrant, and your left lower quadrant. So vowel sounds are normal and there are no vascular sounds present. And so now I'm going to do some percussion in each of those quadrants. So your right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. And now we're going to do light and deep palpation. So light palpation. And now to the left side. And now deep palpation, right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Good. So now we're going to do your lower extremities. So everything looks even, the anterior distribution is even and normal. And so I'm going to feel, there doesn't seem to be any lumps, bumps, or lesions, and there's no pretibial edema. I'm going to feel for your posterior tibial pulse, which is equal and normal on both sides, and now your dorsalis pedis pulse, which is equal and normal on both sides. And so I'm going to have you do some range of motion, so if you could lift one leg up to the sky and back down, and the other side, and we'll do that again against my resistance. Okay? And if you could move this leg out towards me, and to the other side, and this leg in towards the wall, and to the other side. And if you could bend your knee to chest, and the other side. Good. And if you could point your feet downward, and out, and inward, yep, and outward, and squint your toes. Good, and your toes look healthy and trimmed. So now you can sit up for me. And I'm going to assess your neurological. And so now I'm going to assess your cranial nerve 5 with the soft end of this Q-tip. So let me know when you feel this on your face, and you can close your eyes. No, 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 no. Good. So now we're going to do sharp and dull. So this is sharp and this is dull. I'm going to do it on your hands, your arms and legs. So let me know when you feel these. Sharp, soft, sharp, soft, sharp, 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 soft, soft, soft. Good. And so now I'm going to have you put your finger to your nose and back to my finger. Good. And finally, I'm going to have you put your heel to your shin and drag it downwards and onto the other leg. Okay, and now you can stand up for me and just try and stand still and close your eyes for 20 seconds. Okay, and you can open your eyes, and that concludes your head to toe assessment, and I think that everything went great. Thank you.
Thank you.